Good morning, everyone. Thank you for joining our webinar, the first webinar, as far as I know, that we organized in the Switzerland IRM chapter. Topic of today's meeting is employee mental health, the hidden risks of the pandemic. Hidden risks, I think, in two ways. One is the aspect that usually mental health aspects are dealt with by the person individually, and it's hard to identify them. On the other hand, hidden risks, because from a risk management perspective, we tend to not address them in the way that we consider them as that much of an impact. But to address this today, we have fantastic experts who address the topic from different angles. And first of all, we have Melissa Pitotti, we have Cécile Bastien-Remy, Clive Campbell, and Stefan Messer. Moderated will the session be by Stefan Messer, who will introduce our speakers in more detail later. What I would like to do is take the opportunity, since this is usually we have this face-to-face, just some organizational aspects about the Switzerland chapter. You might have noticed that we have a new committee, and I'm very happy that we have these people on the committee. That is myself as chair, Stefan Martin as secretary, Fatima Sherif Noor, Rose Mora, Daniel Imhoff, and John Pottage in the committee. What I really appreciate about this is, first of all, that we address many different industries, but also these people are very experienced risk managers and have a great network within Switzerland. Our ambition for further helping the IRM regional group in Switzerland is that we want to do a bit different approaches on communicating, not only centralized in Zurich, for example, but also use different media, use different locations, and maybe different formats, so that we can exchange better as a risk management community. And for this, we had sent the survey, because what we actually wanted to know is, what do you want? Which topics should we address? What can we improve? And we will consider this for the program to go. And I tried to keep this very short. So next thing is, let's go to the webinar itself, the employee mental health topic, and I hand over to Stefan.
Thanks a lot, Pascal. You said you would be brief. Well done. You kept your promise on this. So, ladies and gentlemen, we'll now give the power of speech to our experts, and each of them will be asked questions, and then we'll open the floor to attendees at the end of each slot, and Pascal will monitor the question box for you. So in advance, thanks to all four experts in making the time for joining us and sharing their personal views. We will now begin with Melissa Pitotti. Melissa is the co-author of a report called Working Well, Aid Worker Wellbeing and How to Improve It. And her most recent podcast interviews include discussions with mental health professionals about responding to COVID-19. So Melissa, here is my first question. What was your personal experience going through the lockdown period?
Thank you for the question. And first, thank you to the IRM Switzerland for taking time during Mental Health Awareness Month to look at a topic that some people consider taboo, but it affects many of us, many of our friends, many of our colleagues. And I myself, I have experienced burnout and depression. And just so you know what burnout is, according to the World Health Organization, it's a chronic workplace phenomenon where people feel three things. First, they feel exhausted. Second, they feel very cynical or negative about their work. And then they have reduced professional efficacy. This is where they might be less productive or be making mistakes. And depression, according to the WHO, is one of the leading causes of disability in the world, affecting 264 million people. So I had experienced that before the pandemic. And I had created my own wellness regime to, if you look at the risks of having it again, I wanted to mitigate the risks. And so I had found a good set of practices and routines that I wrote about on social media and got a lot of feedback from aid workers in my sector. But I couldn't do them anymore because of the pandemic. So I was working out at the gym with other people every day. I couldn't go to the gym. I was planning ahead my healthy meal planning, buying ingredients online. I couldn't do that anymore. Here in Switzerland, my provider was no longer available. I had been meeting up people for shared meals, having fun. I couldn't do that because of stay at home. I had been going out to nature, couldn't do that. And I had also been trying to reduce my consumption of news before because I found it was really stressing me out. And with COVID-19, I felt I needed to monitor the news more. So in addition, I was 9 months pregnant. So I couldn't take my medication anymore. My family members flying into Switzerland could no longer fly in to help me with the baby. I wasn't allowed to have visitors at the hospital, and I wasn't sleeping. So all my wellness plans out the window. But the good news is that despite the pandemic, I could keep doing a few things to help mitigate the risk. I could keep meditating every day. I use an app on my phone for 10 minutes a day. Because of my situation with my previous work, I decided I didn't want to work in an office with open space. So I had already been teleworking as an independent consultant when the pandemic hit. So for me, it wasn't a problem to work from home. I had already had a lot of virtual contacts with people. So through the pandemic, I was able to keep the Skype going with my family. I was able to have Zoom calls with my friends. And when the baby came, I was very impressed at how many people still managed to send food or sew us masks, do really great things despite not being able to come physically just to send their support. So on the whole, I had an okay experience with the pandemic, but I heard from many people that they were struggling and still are struggling for a variety of reasons that we could get into later.
Yeah, thanks for that first answers. Now, how can you relate to theories or process steps you undertook in your professional activities?
Okay, so I come from an international humanitarian aid sector. So this is nonprofit. This is mission focused. There are a lot of people working in office jobs, but there are a lot of people working on the front lines, delivering healthcare, shelter, construction, food and non-food items, doing some protection work with legal things. So they need to interact with people. So we had found through some work that I did with Marianne Clements and the CHS Alliance, we did a mapping of worker well-being in the aid sector, and 3 things stood out to me in terms of risk. First, the likelihood that staff will experience mental health issues is very high. It's very common, even in the best of times. In 2015, for example, a survey done by the Global Development Professional Network found 79% of aid workers had experienced mental health issues, and 93% of these said it was because of their work in aid. The second thing I'd like to say on risk is the contributing factors. A lot of people assume in aid work you're feeling stress and mental health problems because you're exposed to war and natural disaster, and maybe now the pandemic. But a surprising thing that we've seen through the surveys is that a lot of people are also impacted by more of the mundane chronic stress related issues, like maybe at night you're not dreaming of the hijacking, you're dreaming of an argument you had with a colleague or your boss. There was a survey in 2019 by the UK and Ireland Unite of people in NGOs and charities. 42% believe their job was affecting their mental health. And why? 44% said they believed they didn't have a well-managed organization. 34% said their work wasn't valued. 40% said their work wasn't secure, their job wasn't secure. And they're talking about things like bullying, harassment, lack of autonomy, and the epidemic of stress. And there was a study published just this month about risk and protective factors for aid worker mental health. And a lot of things that were discussed as a risk factor were things like low wages, short-term contracts. And importantly, something that keeps coming up is gender. I don't know about you, but a lot of people I've been talking to say during this pandemic, a lot of the new work associated with working from home and teleworking, a lot of women felt extremely under pressure to deliver on all fronts there. And you see a lot of women in general having special issues. The third risk factor I'd like to talk about is the impact. We found a UN Medical Services Division Global Wellbeing Survey in 2015 found 49% of UN staff were experiencing things like depression, anxiety, post-traumatic stress, hazardous drinking. And this resulted in a lot of turnover, a lot of sick leave. They call it absenteeism, but also there's presenteeism where people come to work even when they're sick. And they tested out the costs for this in 3 of the UN agencies and found it was over $11 million. So there is a financial repercussion to not addressing mental health issues that a lot of people don't consider. And finally, before we go to the next segment, I just wanted to point out that Deloitte did an analysis at the beginning of this year of UK employers saying that poor mental health costs $45 billion a year. And for every £1 spent by employers on mental health, they get £5 back in reduced absenteeism, presenteeism, and staff turnover.
Thanks for the insights and the figures. One last question before we open to the attendees, if any. What are the risks any employee and organization should take into account when confinement period is over and employees come back to work? What would be your advice on these situations?
Okay, so this is what I'm hearing from people in my network during this time of uncertainty. First, I'm afraid going back that people will get sick. I'm afraid for my financial security. I hear people say I'm grieving, so they've lost people or they're people sick, they've lost their former way of life. A lot of them experienced isolation and felt very lonely during the pandemic. I'm angry, so I've been expected to deliver way too much for the circumstances, especially if they have family obligations or they've been asked to pick up the workload of others. I've heard I'm overwhelmed. So because the workload wasn't confined by a work day so much, if you're working from confinement, you can work from the morning to the midnight, and a lot of people have been overwhelmed by that. Also, if they're in healthcare situations and subjected to what has happened in some hospital contexts, etc., or other occupations that have been really at the thick of things in the front lines, and I'm burned out. I'm hearing that. So in addition, there are variations depending on their circumstances. So I would just like to ask, where and how can these feelings be processed coming back into the work environment? We found from a survey done by the START network that 44% of staff say they're not willing to go to their employer and say, I'm struggling. And why? Because they are feeling they're not going to be promoted or they're not going to be deployed. They feel that maybe there's a taboo about having a mental health issue. And if anything the pandemic has done for us, it should be to say it's not a taboo to be feeling these things, to be suffering with your mental health. It's very common, and we need to have environments at the workplace that are willing to talk about these things. So I'm working on a project now with Marianne Clements and the CHS Alliance Initiative to cultivate caring and compassionate aid organizations. It looks at the intersection between mental health, people management, and organizational culture. It looks at different levels. So we don't want to see individuals taking it all on themselves. We want to see managers equipped to deal with this, and we want to see organizations doing their duty of care. Because within the humanitarian sector, there's a standard and organizational responsibility for organizations to promote well-being and avoid long-term exhaustion, burnout, injury, or illness. And one of the core competencies is self-awareness. So what we want to see is use pandemic as an opportunity in your organization to create spaces for conversation, to, from the top down, say, we expect people have been going through a tough time, and we want to create cultures in our organizations where we can talk about it, where we're aware of these things, where we have resources that we know where to go to. And within the CHS Alliance, we've been putting forward these spaces for conversation for people in a different context, because they're all over the world, to say, this is what we're seeing. We're not meeting the standard. Only 2.4, an average 2.4 is a score out of 4 from the organizations in the Alliance on that responsibility. we're not meeting the standard, but what can we do together to meet the standard? So we want to support more of those kind of conversations and activities going forward.
Thanks a lot, Melissa. Great insights again. Thanks for sharing all these numbers. They're quite relevant in these times. Pascal, do we have any questions from the question box maybe before we go to Cécile?
No, we don't have any chat or questions, but I encourage you, if you have any questions, then please use the question box or the chat box, and we can pass on these questions to the panelists.
Okay, thanks, Pascal. So now we go to our second speaker. It is Cécile Bastien-Rémy. Cécile is an international communication and presentation skill trainer and keynote speaker on the topic of resilience. So we'll see what she tells us about today's session. We just have to apologize. We do have a technical issue with the webcam. So you will hear Cécile. She will answer to the questions, same questions as for Melissa, but we won't be able to see her. Anyway, so Cécile, here's my first question. So what was your personal experience going through the lockdown period?
Well, thank you very much for asking, and thank you as well for IRM Switzerland for welcoming me into this webinar. Now, the lockdown, I can see that I experienced the lockdown within 3 phases. The first one, I realized that I was surrounded by people with extreme emotion. So it went from complete denial and also really high anxiety. And I could not recognize myself. So the first phase was really for me to not even listening to the emotion of others and even mine. And I started doing, because doing is something I can control. So it was actually very comfortable for me in this brand new situation that we feel that everything is escaping from our life. We can't go out, we can't go to work, everything is upside down. So for me, doing was my way of controlling the first phase. So by doing, I mean staying home, organizing my teenage girls, making sure everybody was eating really healthy meals, finding a discipline a little bit like Melissa was mentioning about reading and meditation and sports and everything. So that's the phase number 1. The second phase, when I realized that it was a blessing for me because I really needed to slow down big time. I had a very, very busy 2019 and early 2020, and I've got a small business. That means that whenever the business is coming in, it's not a question of yes or no, it's always yes. And the problem is you forget about your physical recovery time, your emotional recovery time, and your intellectual recovery time. You need to feel all of that. So the second phase was for me to realize, you know what? You don't have to do all those things. You don't have to be the little hamster running in the wheel. Take the time and enjoy that moment. So that was the second phase. Now I feel I'm in the third phase where I go, what's next? How do I want to change? Who I want to become? Do I want to go back to the little hamster running in the wheel, or do I want to readjust? So the third phase for me is more the putting in place some of the learning points that that were raised up in the second phase.
Now, how can you relate to theories or process steps you undertook in your professional activities?
Okay. When I was 21 years old, and again, I think everybody's mess is their own message and their own learning. So Melissa talked about a burnout. Personally, I had a car crash when I was 21 years old that left me 45% disabled. Now that 45% disabled is an insurance number. It's not at all how I feel. But that experience at 21 years old allowed me to understand the process of resilience. And that's basically what I've been putting in place to go through and adapt my business. So the first phase within the resilience process, the way I see it, and again, this is my own interpretation of resilience, is that you have to accept and surrender. So there was things that I couldn't do. I had clients that postponed or cancel contracts. So what is it that I can do within that environment? So understanding what you can and cannot do is very important, because you can't put a positive filter, because long term that's going to impact you. You're going to be disappointed. You don't want to be disappointed. You have to use a realistic filter to the situation. Okay, don't be over dramatic, but don't be over positive as well. Once you've done the inventory of what you cannot do, then you're very likely to adapt. You're very likely to find solution. Okay, so when you do that, you're ready to bounce forward. And I love that expression, you know, resilience, you look in the dictionaries, to bounce back. For me, it doesn't make sense. You want to bounce forward and even further. So bouncing further will be actually the second phase, where you have to, well, not have to, but my strong advice will be to understand, who do you want to be in that situation? Do you want to be your own hero? And to be able to do that, to be able to advance, you need to have a vision. The vision is going to help you go over the big waves of this storm that we're going through. You have the rudder, you know, is your vision and your mission and how you want to be. It's very important to have that, because then you see over, you're not the head in the mess. You automatically bring some hope every day. And there are very simple action that you can take every day to work toward that vision. Okay, so who do I want to be will be the first question, and how I want to do it, and what is my ultimate goal? What is the sun that I'm heading for on my journey? Now, what's important as well in this phase is perhaps to have role models. And one of the role models in terms of economic, the ability to pivot, is an example that I found actually of a Swiss company, and it's Victorinox. If you look at Victorinox, before 9/11, they were making 95% of their revenue with the little knives. After 9/11, it was just impossible to bring back, you know, with you in your luggage, coming from Switzerland, or just as a retirement gift or graduation gift. You just couldn't give that any longer. But the good thing is that if you look at the way the CEO, it doesn't think about the next EBITDA. It doesn't think about, you know, what are the results of the next term. It thinks about the next generation. And thanks to that, they managed to play the infinite game, and they could pivot much more easily. So there are some examples out there that are, and now if Victorinox is only making 35% of their revenue with the knives, and the rest is all about watches and gears for traveling. So be inspired by other people that understood that, you know, it's not only going up or going down, it's a wave, and we just have to find a way of surfing it. So that will be my answer for that question.
Thanks a lot, Cécile. Very personal insights again, and then the link back to the business. Maybe a few words on that last question. So what are the risks you think any employee organization should take into account when confinement period is over, and so employees coming back to work? So what would be your advice in a few words?
I don't have advice as such. The funny thing is, you know, during the lockdown, I was providing interviews, you know, to bring value to my clients. And when I asked the question to some of the PhDs, you know, in organizational science and everything, no one wanted to answer that question. And I really wondered why. So from my network, what I hear is a little bit what Melissa was mentioning. You know, there is doubts, there is a trust issue, there is confusion. People are scared about their health, they're scared about their economic level. And I think instead of giving pieces of advice, I would encourage people to ask themselves questions. And we don't have the answer because we've never lived that. So the best way is to find answers. So answers about your self-care. How would you do? What would make you comfortable to go back to the office? If you have a reflection on the experience, what did you learn? What's better now than before? And again, you know, back to the question, who do you want to be? So that would be on the employee part. And for the organizations, I think we're going to see two main spectrum: the good ones, the bad guys that are going to kill their reputation, firing thousands of people over Zoom. I'm not mentioning Uber, of course, I am absolutely not. But there might be some leadership shifts, you know. And again, organization, they may want to ask themselves, what future do they want to create? Again, I don't have the answer. I've got answers, of course, for me with my values and my experience, but I don't have answers for everyone. And again, perhaps the first question is, where do you want to see the organization in a year time, in 2021? And I think if we start short term, that could probably bring easier answer. And that will be my 2 cents, Stefan.
Yeah, thanks a lot, Cecile. Well, you said you don't have any advice. I think you did give a few advice by asking ourselves a few questions. So thanks for that. We'll now go to so Pascal. Any questions on the question box?
We do have two questions, one to Cecile and one to Melissa. Let's do the one to Cecile first. How can we engage colleagues continue striving towards adaptation?
Sorry, how can we?
How can we engage our colleagues to continue striving towards the adaptation?
The adoption of what? The adoption of the change, or? I'm not sure I understand the question. So I will just answer on the, basically it comes down to motivation.
So the answer
I think that's the way I understand the question. Motivation is down to communication. And communication is not just talking. There is actually a lot and a lot and a lot of quality listening that needs to be done, especially from leadership. This is the time to listen. So that would be my main advice to keep people motivated. But I would say, if I refer back to one of the motivational principles that I personally find very relevant and very simple, is the one done by Daniel Pink in his book called Drive, where you leave people with a fair amount of autonomy, where you find together a purpose for the team and for the organization, and that you develop a mastery. Look at what people want to develop. And you have also to accept the fact that there would be loss of efficiency. If you can't accept that, that's going to hurt. So that would be my answer. Hopefully there were items that the person who asked the question would be enlightened with. That's my hope.
Great. The other question towards Melissa. The question is, actually it's two questions. Do you see the risk that the crisis can lead to a detachment between employees and employers, leading then to valuable employees changing to competitors? And the second part is, do you think that leaders are prepared to the crisis, or are they overwhelmed themselves?
Very good questions to those who asked. Yes, I do think that there is a risk that employees and employers can be detached. I feel, talking to some CEOs and managers, they felt a bit vulnerable during the pandemic, where they couldn't see people face to face. So a lot of communication happens non-verbally, and also a lot of managers were feeling anxiety. And when people feel anxiety, some of them tend to want to micromanage, which is a bit harder to do from a distance, but still people try through lots of emails, text messages, etc. But what will be important in the transition from the pandemic to this new world, we might be, I heard in the news, co-living, co-vivre with COVID, will be that employers and employees take this opportunity to say, the way we were working before was not sustainable, and we need a new way of working, and let's use this opportunity to have more frank communication. And as Cecile was saying, let's try to build trust and find ways, hopefully driven towards purpose, like Cecile was saying. Otherwise, especially with those who experience burnout, you don't care anymore. as an employee, I don't care about this organization's success. I become very cynical. I don't feel valued, and I'm going to walk as soon as I can find another opportunity that will provide me some financial resources. So it is important to invest in worker well-being and to invest in good people management and to invest in organizational cultures to have more sustainability. The second question was about, are leaders prepared? What I've heard, and we actually had within the CHS Alliance a webinar on April 2nd, a webinar with CEOs of 8 organizations, how to lead through the pandemic with compassion. And compassion is a word that a lot of people don't like, but what it means is it's 2 parts of the word. Compassion, I feel someone suffering and I want to do something about it. So I'm empathizing and I want to take care of the issue. That means you have to be aware. So a lot of leaders are becoming more and more interested in how can they become more self-aware of their own situations, and then how can they have conversations with their teams and be seen as vulnerable. And here I'm sure many more are coming for coaching, many more are taking advantage of mindfulness training, many more are coming forward. There's new courses now on compassionate leadership. But I think unless CEOs, and I've heard some of them say, can we have more opportunities to talk to each other? Because many leaders are feeling the same stress because we want to do well by our teams, but we have stress from our board and we have to pay the bills and make the mission of the organization. So I think that everyone is struggling through this together. Hopefully they can do it together in ways to be seen as mutually supportive.
Thanks a lot, Melissa. So Pascal, I think we're going back to our speakers now. So our third speaker is Dr. Clive Campbell. Clive is the Chief Medical Officer and Head of Occupational Health at Syngenta, one of the world's largest crop care and seeds companies. So Clive, here is my first question. What was your personal experience going through the lockdown period?
Well, thank you for the question and thank you for inviting me. Very interesting for us because quite early on we established with most governments that our work in the production of chemicals and seeds to enable food production was considered essential. So that meant that we were not only enabled to, but we were encouraged to keep on with our production work and our seeds R&D work, which meant that we effectively had two very clear populations as we moved towards lockdown. And the first was those people who had to continue to go to work, or those people who were able to continue to go to work, depending on your point of view, and those people who had to move from home. And we had a small population who perhaps should have been going to work, but for health reasons were unable to. So I think that to put it into a degree of context, that was part of our challenge. Now, the first thing looking back at it for me was the rapidity with which things suddenly changed. I distinctly recall coming back from London to be dragged into a meeting with some of our senior leadership to start to discuss a much more rigorous program for travel restrictions. And so we started very much looking at how we managed travel, and that was the first thing we started to look at in the corporation. And it was fairly straightforward. We took advice from our great friends in International SOS, and we looked at the travel advice that they were giving of the countries that seemed to be hotspots. And we would say, well, don't go there. And if you do, you need to go to quarantine for 14 days. And then it seemed like over a weekend, the International SOS was sending out these updates that stopped saying a country name, and they said a region of the world. It's America, it's Europe. And that sort of pretty much changed everything. And that was very, very rapidly followed by various national moves towards lockdown. As I mentioned, we're an organisation that is encouraged to keep working during this period. So we had challenges getting workers across the border. Many of our facilities, like Basel, is very close to the French and German borders. and actually so is our facility in Monte in the south of Switzerland, close to the French border, and not so far from Italy. So again, we had concerns about how we would get workers in and out. But I guess for me personally, I was staggered by how quickly things progressed, how rapidly we needed to start to take action, and how little information we really had upon which to make decisions. So the first thing I had to do was to sit down and work out on a not on a case-by-case, but on a generic level, how we would manage a case in the workplace, what we would have to do if somebody at work turned out to have COVID, or indeed appeared to have COVID. So that was, we had to produce guidance on how we would manage that, how we would manage the contacts of those cases, and how we would manage the contacts of the contacts. At what point did you draw the line and say, well, actually, no, you can continue to come into the workplace? Although, of course, as we moved much more to home working, that became less of a challenge, but obviously it remains a challenge in the production facilities. So we moved very much to home working, and that created a set of challenges for us. I think the first one was people would start to feel dislocated, and people would feel that they were unable to people felt they needed to have permission to communicate with the more senior members of staff. So one of the key things that we put in place was a number of opportunities for communication. So we would have senior leader, or indeed just leader, webinars with members of their staff, or indeed broader communities. We created a dedicated website, SharePoint, TeamSpace, whatever you wish to call it, where we would put updated information, and information on simple well-being techniques, information on how to set up your non-ideal workspace to accommodate your new laptop and maybe a mouse, and maybe you managed to pinch the keyboard as you left the office. How to set that up. We would then look very much at making sure that we would create interaction sessions and encourage people to talk. We, of course, we reminded people that we have an EAP, whether we like them or not, we have an EAP, and that we would encourage people to remember that we've got this and to use it should they feel it was important. Interestingly, in the initial phases of the lockdown period, EAP use went down, but it's actually gone up more recently as the lockdown period has increased. I think Melissa has very much covered the key challenges. That's why our people had working late into the night, because they were looking after their kids during the day, never feeling that they could switch off. I personally felt a responsibility to look at every email all the time because it might be a critical health issue. I've gradually managed to get over that. So I think that's been my experience so far.
Yeah, thanks a lot, Clive. Linked to that, would you have any anecdotes linked to your experience to share with us?
Well, reflecting on what I just said, I think there came a point a couple of 6 to 8 weeks into the into this period where I personally realised that I was watching the news all the time to see if anything had happened. And of course, if you watch bad news at 12, bad news at 6, and stay up to watch bad news at 11, then actually you sort of live in a bubble of bad news. And certainly much of the media has presented the COVID as all bad news, and to be fair, much of it is, but it's not all bad news. So I kind of felt I was getting a bit of news overload. I also felt that I was getting media overload. I'm quite elderly, as you notice, and of course, when I started work, information was transmitted by a letter, which was a piece of paper like this. I don't know if anyone remembers, and and you would read it and pass it to someone else. But then all of a sudden we used to get emails, and now I'm finding that I'm being added to WhatsApp groups by managers, leaders, or by people who wish to keep in contact. So I was feeling I had to watch this all the time, and I started to reflect about what I needed to do, and I think the first thing I needed to do was to decide I shouldn't worry about things I can't control. I can be interested in them, but I can't worry about them, and I need to act on the things that I can act on, which is keeping in touch with people and making sure that I can do the right things in terms of exercise and diet and beer and wine and stuff. I think that's down, isn't it? Yeah. The other thing is, in a workplace, I think it's easier to look at things strategically. Sitting in a small room on your own is perhaps better to look at things in terms of manageable chunks, making a clear plan for the day, executing that plan, and then remembering to stop at the end of that day. As I mentioned, I kind of felt that I had to be available all the time. So what I actually did in the end was identify a work colleague or a buddy who I could buddy up with, and we could then share we could then share or take turns, if you like, to be available at the weekends, or in fact take turns to switch off from all the social media and all the emails at the weekends. And again, I've not been too bad, but I think it's important to be able to recognise my feelings, to say, actually, I'm not coping. I now need to do something about this. And I think it's quite hard at times sometimes if the current gets stronger, you just swim harder and harder, and all of a sudden you realise that that's not the thing that's going to help. You need to cling onto the bank for a bit. Okay, it's very important to keep in contact with people. So now, I cannot imagine even 2 years ago that we could have had a call like this, let alone have done all our work over Zoom, although I understand other social contact platforms are available, to just keep working. And I think I was reflecting that from the age of about 13 months to recently, I think my granddaughter thinks that I live in a mummy's telephone, because this technology is really important. I think the other thing I recognised I needed to do was to actually say, I am allowed to stop working and do the things that I enjoy. So I am allowed to go and sit in the garden, or work in the garden, or play my guitar, or whatever it is. I'm allowed to stop. So I think that would be my anecdotes.
Thanks a lot, Clive. So trapped in the bad news. Maybe one last question then, just in a few words. So what would be your advice for employees going back to work and their own organization? What type of situations we would like to avoid?
Right. I think what we don't want to do is to say this is a free-for-all, you can come back to work, it's just like it was, because frankly, it isn't. So we in our offices are very much having a regulated and managed return to the office. We've got to be careful not to say return to work, because people have been working, but they're returning to the workplace. So I think we've worked very closely with facilities management to make sure that we've identified any areas where people will congregate so that we can maintain social distancing. We've moved desks around so that they're at least 2 meters apart. We are absolutely restricting the number of people who can return to the workplace in one go. So we had a trial with about 100 people in the Basel office to see how it all worked and how the people flows worked and how the canteen, for example, could cope. But we're now looking at A and B team working. So we've got two teams that will never have more than half the people. And I think from an individual perspective, go back if you can work from home and you wish to continue to do so, agree that with your line manager. Don't feel compelled to go back if you're worried about your health or you have health concerns. Conversely, many people are desperate to get out of the house and back to the office, but don't rush, take your time and be and absolutely follow all the advice, strict rules the organisation's put in place.
Thanks a lot, Clive. Great advice here. Pascal, if there is a question, maybe a very, very quick one before we go to Stefan, so we have time to hear all his answers as well.
Yeah, we actually do have a question which addresses it from a corporate perspective, and it's two-faced again. So first of all, do you think human resources, health and safety, and risk management departments were prepared to such a crisis? And the second part is, what would you advise to those colleagues to get engaged across corporations and use it as an opportunity?
I think the organisation had got capability for emergency management, and this was very much an emergency that we started to manage, and it involved all those groups that were mentioned in the question. I'm not sure that any particular group. I think HSE had got an idea that we needed to have continuity plans, but actually we had to run very hard to get those put in place. Although we had some from the original SARS and bird flu. And I'm sorry, what was the second question?
The second one is what you would then suggest to your colleagues to get engaged across companies and turn it into an opportunity.
Yeah, I mean, I think we actually have now as we've moved from an emergency to a crisis, we now have a crisis management team that is starting to look at exactly that sort of question. How do we take this forward? What does this mean in terms of how we work in the future? For example, I doubt we will ever work in exactly in the same way that we did before. But this is, if you like, small sub-teams within the organisation are addressing those questions.
Thanks a lot. So I guess we can move to Stefan Messer, so our fourth and last speaker of the day. Stefan is the Regional Medical Director, Central Europe at International SOS, world's leading provider of medical assistance, international healthcare, security services, and outsourced customer care. So Stefan, we're closing the expert slot with you. So same question as for the others. What was your personal experience going through the lockdown period?
Yeah, International SOS, as you explained, takes care for business travelers and for expats. And we do that on one hand for groups, for organizations, as Clive explained, and on the other hand for individuals. And the experience which I saw from individuals was that we got a lot of calls coming into our assistance center. Some people call it a call center, we call it a medical assistance center. And I saw always when people called concerning COVID, two dimensions. The first dimension was the technical interest, technical questions. Can COVID testing be done in Malaysia? Can COVID testing be done in Zambia? What are the treatment options? Can International SOS evacuate us if we have a problem? But if you took your time and talked a little bit with the people, you very quickly realized that behind these technical questions was in the second dimension a lot of fear, a lot of uncertainty of the people, and often the technical questions were just the reason to call, but in the end they wanted to discuss this uncertainty, this fear. They focused a lot on one risk, on the COVID risk only, and obviously those who lived in foreign countries were afraid of cultural barriers and hurdles and problems which might become worse or more prominent under the crisis.
Yes, fully understood. From this experience and from this period, do you have specific examples or anecdotes that happened during the lockdown period?
Yeah, what for me was interesting was how people suddenly focused on one risk only. I had a long discussion with a client who had a project in the center almost of the so-called Democratic Republic of Congo, the former Zaire, in the center of Africa. And this is a country, and they lived in a very remote area, more than 180 kilometers away from the next town. And this is an area where you have all the risks you can imagine. There is malaria and a lot of other infectious diseases. There are snakes, there are spiders. There's a lot of violence. There is no governmental structure. There is no protection from the police and so on. You're really depending on yourself. There are bad roads and bad cars, so the risk of traffic accidents is high. There is no medical care. So these people had a lot of risks, and they had been there for 18 or 20 months already, and they didn't care for all these risks. But now, 1 hour, we discussed the risk of COVID, which was for this group of young people, young engineers between 30 and 40, definitely not the highest risk they had and would never be the highest risk. But we discussed 1 hour with a group of people about COVID in Congo. And these people never were afraid of any of the risks which I just mentioned. So this is interesting, how suddenly all the world is focusing on one risk and everything else is neglected. The second example was indeed a cultural issue, a cultural experience. We had a child, or something between a child and a youngster, a 13-year-old girl in China, in a larger city in China, and she indeed was COVID positive. So following the Chinese regulations, she had to be taken to a hospital. She was treated there. She was well treated. She was treated in a correct way. Everything was fine. She recovered, but although she was only 13 years old, for weeks, if I remember right, for 4 weeks, she was not allowed to see her parents. So she was living in a hospital room with another 2 or 3 children, I don't know exactly anymore, but completely separated from her parents, something which in Europe we could not imagine. Yeah, parents are allowed to see their children, even under the situation of this crisis at the moment. In China, this was very clear. Our assistance center in China talked to the hospital, and they said, well, this is the way they handle it in China. They separate the infected from the non-infected, independent whether this is children or parents or whatever. That's to a certain extent a cultural experience which we made, which was a big issue for this family. They survived, but it was a big issue for them.
Yeah, we certainly don't think about these things. We live too far away from that, except if you experience it yourself. Last question before we close. So again, as for the other experts, what are the different risks you think employees and organizations should take into account, and what would be your advice to avoid these situations?
Yeah, we have a lot of discussions with clients at the moment, with companies who plan to manage and go into return to operations, return to travel also, travel again to China, travel again to Democratic Republic of Congo and other places. And what we always say, and this comes back to what Clive said as well, you need a plan. Nothing happens by its own. There is no automatism. There is no simply go back to how it was. It will not be the same. So you need a plan. And I think this goes back to what Melissa said, communicate this plan and communicate it permanently, not just once in one announcement or one WhatsApp or whatever, but communicate it permanently, have it as a living plan, which is communicated to the people who expect that. And we have good experience also with offering what Clive called EAP, as Employee Assistance Program. We can call it a hotline, as it was called maybe a few years ago. There must be an expert or somebody who knows who's talking about to communicate the issues around this return to operation, return to travel, because there will be a lot of uncertainties. A lot of things are volatile at the moment. Not everything is already regulated because authorities, organization, everybody is learning and is adapting and is permanently changing things. And yeah, I think at the moment, we also have to live with uncertainties, with ambiguity, with lack of clarity. Yesterday, we had a discussion in our own company. We have, as most companies have, a smoking corner in front of the entrance where people who are not allowed to smoke in the office anymore are standing around. And I was asked, do we need social distancing in the smoking corner? And I said, yes, of course. Otherwise, the people have a risk of a serious lung disease.
Excellent, thank you very much. So we're at the end, so I'll hand over to Pascal for the question box, to Stefan or to others. I just would like to thank on my side already the 4 experts we had with Melissa, Cecile, Clive and Stefan. So I'll hand over to Pascal now.
Yes, we have one more question, and that's about how you, Stefan, see the impact on globalization and interconnected world post-COVID-19.
Well, I don't have a crystal ball, but one thing seems clear: the level of traveling, which was very close related to this globalization. A lot of people could go to a lot of places. I don't say everybody could go everywhere, but a lot of people could go to a lot of places. I have the feeling this will be reduced for a long time. And if you look only as one aspect at the rules which the international aviation associations like IATA or other ones at the moment try to impose and to implement, you see that traveling, long distance traveling, will be much more inconvenient, less easy to do, and so this will have an impact. It seems that the impact on trade is not that big. Trade continues. What we always see is that people who are involved in trade have still open access. Yeah, I live in Frankfurt and in Aachen, close to the Belgian-Dutch borders, to the French borders. For us, as normal people, and Clive mentioned his experience with traveling from London, it's difficult to travel. If you sit at the steering wheel of a lorry, you have still an open Europe. As a lorry driver, you can go from the Dutch North Sea coast to the Black Sea in Bulgaria inside 2 days. The borders are still open for trade, which is an interesting experience. And obviously, the technical equipment which we use at the moment seems to become a much more important. Seems to get a much more important role in the future. That's our experience. But still, we see that in the discussion with our clients that there is a need for traveling. There is, in the modern world, still a need for traveling. We permanently, every day, discuss urgent business travel requests and how this can be facilitated, how it can be made possible.
Thank you very much. And with this, I would also like to thank all of our speakers. Very great insights. Thank you very much for your expertise and also your personal aspects. Thank you very much to all the audience who dialed in today to see and hear what we are talking about. And I also would like to encourage you that for our next webinars, because I'm pretty sure that from a Switzerland chapter, we have more webinars, not just because of the pandemic situation, but because we also want to use the new media, that I encourage you to join those hopefully interesting topics then as well. Thank you very much and have a great day.
Thank you. Thanks for the invitation.
Thank you. Bye-bye.